Good morning, everyone. Hope you're having an amazing Monday morning and a big old cup of coffee. Welcome back to Coffee with Kim and Hills. I would ask you how your morning is, but I know that it's been a little
hectic.
Yeah.
Let's just say public transportation has not been my friend this morning.
No, public transportation in New York City, I have to say, has caused me some of the greatest stress in my life. It's no joke.
No.
Like when it's not working, it's not working.
No. And when it's off from what you think it's going to be, it's just like, so there's just like, and there's nothing you can do about it.
No, you're trapped underground.
And so you're just like, I'm going to be late.
And half the time there's no service.
Yeah.
So the worst is like when you're on the train, it just stops in between and no one's saying anything.
Yeah.
And you're like, what's happening? And you can't like text, I'm going to be late. Oh,
Right.
It gives me sweats thinking about it. I'm
Sorry,
telling you
we
right
don't
now.
have to talk about it. Let's just say public transportation is a wonderful thing when it works well and you have all the time in the world.
It really
But when
yes,
you're
it
stressed
can
out
be
about
wonderful.
timing and it's not working
No, totally.
the way you had anticipated, it's a little tough.
Yes, it really is. So I'm sorry, you had a stressful morning.
How was your morning?
My morning was fine. My night was a little rough. We just had, our little one was just wanted to hang out all night. She did not want to sleep. It was like, oh my goodness. My husband and I were just taking turns back and forth. I feel like every hour. And I felt like it was back to the newborn phase. Maybe she's prepping me for my next newborn phase.
You're like, but I don't need you to prep me for that.
No, I need to sleep right now.
I need to sleep right now, and I'll get through that when I have to.
Yeah, exactly. I'm like, please. Now's when I want to like get the sleep before I lose the sleep again. Come on, child.
Exactly.
But I've got the coffee.
Coffee is a godsend. Let's just say that.
Coffee is a godsend. And now we can just like immerse ourselves in some really great hot topics and forget about a bad night's sleep and a horrible commute to work.
And instead, talk about healthcare debt.
Oh gosh. It is very real. I feel like a lot of people watching this are like, oh, it's me. I mean, it's just, it's very real. This is an article from CNBC. 100 million adults have healthcare debt, and 12% of them owe $10,000 or more. This doesn't really surprise me.
No, because our healthcare system is so wonky.
I know.
And
it's so confusing.
It's so confusing. And even if you have healthcare, you still own money.
Yes.
If you don't have healthcare, you could have these surprising events happen where you have to pay out of pocket
Right.
for everything.
Right.
Nothing is billed at the same rate, which we've learned.
Yeah, no.
Whether, depending on your insurance, depending on if you are insured or not.
Right.
So it's, it's
if you think you know what's going on, you don't know.
Yeah, exactly.
I know, it's horrible. But apparently, some efforts are being put in place to sort of help people. I thought it was interesting with the credit reports.
Yes.
So as of July 1st,
So just the end of this week.
The debt that shows up on your history because it went to collections, but you have since paid it, big credit reporting companies will stop including it on your credit report. And under current practice, it can remain on your record for 7 years.
Yeah.
So that's kind of major, isn't it?
It's huge. I think it's huge. And I think it's a really great thing that the medical debt, because it hasn't been an indicator, and one of the reasons why it's fallen off is because it isn't necessarily an indicator of people not being able to pay their other bills.
Right.
And I think that that's super important because your credit score affects so many other monetary things that happen in your life, your ability, your interest rates, all sorts of things, sometimes even getting a job.
Yep.
Now, I would hope that an employer would look at a credit report with medical debt and be like, oh, maybe they just need a job and some health insurance.
Yeah. Maybe we can just get this person some help.
But
some health insurance. Come on.
You never know about those things.
Totally. So also on top of that, consumers will get up to a year before unpaid debt appears on credit reports. And before this was 6 months.
Yeah.
So you have more time as well. So that's great.
And then in 2023, which feels like forever from now, but it really is only 6 months away.
When I read 2023 and like in these articles, I'm like, well, that's like somewhere in the future.
Right. I'm like,
wait, no, it's actually like right around the corner.
Oh, I know. It's crazy.
I know.
Credit bureaus will stop reporting anything that's under $500. So anything that shows up on your credit report that's under $500 for medical debt, they'll stop reporting that, which I think is also a boon for
so this
consumers.
is good. This can help, people when they're, trying to access credit or loans at a more, favorable interest rate. So that's great.
I think the other interesting points that the article also pointed out, which I thought were something you don't think of. You think of medical debt being this thing that's looming over somebody's head. But it also, because it's looming over somebody's head, it affects their other financial decisions.
Right.
So they went into further detail that 68% of people who have medical debt have cut back on food, clothing, and other essentials in order to pay off that medical debt. Right. And 48% used up their entire savings in order to pay off this medical debt. Which, as we know, these medical emergencies especially can put you back financially, obviously.
Totally.
And then you have to rebuild that savings account, which is what it's there for. It's there for these medical, emergencies that happen, financial emergencies. But then what happens if, it's kind of a reoccurring thing,
right?
Where you then have another one a month later and now you are in some serious financial trouble. So it's really great that, at least your credit report won't be as affected by this go forward.
Yeah, your credit report is important. When it comes to buying a home, I figured it out, and we do want the best interest rates. So, I mean, especially in today's world with them on the rise.
Yes.
But collectively, medical debt in the U.S. stood at $195 billion or more in 2019.
And that was pre-pandemic. So, so many more people have had medical issues.
Oh, yeah.
Because of getting COVID and especially early days, people being in the hospital for days, weeks.
Yep.
So it'd be interesting to see what that 21 number is.
Yes. So next, the No Surprises Act aims to minimize surprises. Like unexpected large medical bills from out-of-network providers being involved in your care without you realizing it, which I feel like can very easily happen because it is really confusing.
Yes.
The in-network versus out-of-network and making sure that you're fine. Because they don't tell you, like nobody's going to spoon-feed you this information.
No. When I was living in the Bay Area, I had Kaiser Permanente, which was an HMO. I believe I'm getting that acronym right.
Yeah.
As my medical, and I had it across multiple jobs and for like 15 years. And it was nice because you knew you had to go within the Kaiser system, and it was very easily, like you just knew. And it wasn't now that I have a PPO, I believe.
I know, it's so confusing.
It is confusing because it says they're in network, but then they actually aren't. And then then you're paying a different rate than you had anticipated, but you've already had the medical services, so there's not much you can do about it.
Yeah.
So that has been frustrating.
Yeah, it all needs to be made more user-friendly and more transparent, which next.
Segue.
They will be adding, hopefully, hospital price transparency rule. Oh, it is in effect since 2021. Sorry. It's been in effect since 2021. Requiring hospitals to post online in a consumer-friendly way the rates they've negotiated with insurers for 300 common medical services. I have heard, I don't know if it was you that told me or where I heard this, but someone was talking, maybe it was Budget Dog, I don't know. Someone was talking about you being like crazy, like checking your, the list of what you were billed for when you were in the hospital, because sometimes you'll look and it'll be like, Advil, but it was that $20 or something.
For 2 pills.
Yes.
Yeah.
So
and you're
always
I could buy a bottle of Advil for $6 for 100 pills. Like, this
absolutely. Yeah. And so
quite...
it's I mean, I don't know if that specifically falls under this category, but I thought that was a really good tip that I'm going to keep in mind when I go into labor and I'm going through, what I've been billed for afterwards. Because I think a lot of people just kind of are, you're like, oh, they know what they're doing.
Yeah.
But, oh, they know what they're doing.
Definitely. Yes. Make sure to check out that bill and negotiate things that, bring, I don't know.
Bring your own. Look
bring
for
your own Advil.
Bring your own Band-Aids and Advil. I don't know. Pillow.
Right.
I don't know what they're charging you for, but I hear it's ridiculous. All right, we're going to take a quick commercial break, but we will be right back with more Hot Topics. Welcome back, everyone. Welcome back to some more Hot Topics and hot coffee on this fine Monday after a very hot weekend.
Oh, man, I do love those hot weekends, though.
I know. The heat wave finally kind of made its way over. I know all of my family in the Midwest, they had gotten it already. And I think it was like up into the hundreds for them, but it didn't like reach, it wasn't that intense. But once it got here, but still, it was like, I liked it.
I know. I did not dress appropriately a couple times this weekend, though. I wore jeans, and I just, it was a bad choice. It was a bad choice.
It's just like, you're like just stuck to it. It's just, yeah, I know.
Just summer dresses. There's a reason why.
Oh my gosh, yeah.
East Coast, Midwest, like South, summer dresses are a thing.
Oh yeah, I'm going to be in just big muumuu dresses, barefoot. Probably all of August, I'm assuming. We'll see. All right, so our next hot topic is from the Wall Street Journal. Buying from Mark Cuban's pharmacy could save Medicare billions, a study says.
Yeah, I thought that this was interesting. I had kind of forgotten that he was going down this pharmaceutical route.
Yeah.
I think it's an interesting, I don't know. We were talking before the show was airing about how kind of a visionary Mark Cuban is and how he's pivoting into this, it feels almost altruistic. We know it's not. There's definitely profits involved.
Oh yeah, that's why he's as rich as he is.
Yeah. Place in the, in the economy. And we all know that pharmaceuticals, there's a lot of money being made in those areas.
For sure.
And not that companies who are making these drugs shouldn't be making money, like by any means, but there definitely seems like there's opportunity to optimize the system for the consumer in a better way.
Yeah, definitely.
And ultimately for taxpayers, especially for Medicare, since we pay for Medicare.
Right.
Might as well get those savings
That's
where we
something
can.
to remember.
I think it's an interesting thing. I mean, in my daily life, I buy things. That's what I do. I'm a buyer.
Right.
And you know that buying things in bulk, so being able to have this massive buying power that Medicare has, would help them curb costs.
Right.
But that's not the current way that that pharmaceuticals work for Medicare.
Well, and they gave a really good example of this. Well, and before I get to that, for people that don't know what this is. Okay, so Mark Cuban's Cost Plus Pharmacy started selling commonly used generic medicines directly to consumers with a transparent fixed rate markup pricing model. Yeah. Okay.
So he charges 15% above the cost that he buys it for, plus $3 handling fee basically for the pharmacy, and then $5 for shipping.
Yes. More than 400,000 people have already set up accounts with this. Yeah. And I think about half have already purchased
products.
Yeah, products through it. So, yeah, I mean,
it's smart.
It's smart. And then to rewind back to the point that we were making. So the price paid by Medicare for a 90-day supply of the acid reflux treatment Nexium is $160 That is more than 9 times greater than the $17 the insurance program would have paid if purchased through Cuban's pharmacy. I mean, that's a huge gap.
Right. Huge gap. Like, that is, I don't know, a lot of money that could be spent other places.
Yeah, it says, okay, so buying the 90-day generic supply would save Medicare $293 million this year. And yes, we need to remember Medicare is a taxpayer-funded health insurance program for seniors. So this is like everyone's tax dollars, right? So there's some major incentive here into, kind of pushing for this.
Yeah. I mean, I think so the pharmaceutical market is so huge.
Yeah.
And Medicare basically pays for a third of it.
Yeah.
So $365 billion is the U.S. prescription drug market in 2021.
Yeah.
Medicare was $115 billion of that. So literally almost a third. And they could have saved $3.6 billion.
$3.6 billion.
Last year by using the service. Now, granted, it wasn't up and running this year. These are all numbers of
doing to kind of show us
what is possible.
Yes.
And I think the other thing is that generics are 88% of the Medicare purchases. So this is what Mark Cuban's cost plus pharmacy. This is what they're doing.
Yeah.
But only 19% of the money spent.
Right.
So yes, we need to figure out this generics business because there's $3.6 billion in savings is nothing to sneeze at. I know it is for the government, but not really.
Not for the taxpayers.
Not for the taxpayers.
Take it.
That could be a lot of other things.
Yeah, totally.
But, brand name drugs is really, that's 81% of the costs that Medicare is paying out.
Right.
And so how do we fix that?
Right.
I think that's another, let's fix one part and then let's work on fixing the other.
I know. There's a lot of puzzle pieces, isn't there?
Yeah.
There always is.
There always are.
But he's stirring the pot, isn't he?
And who knows? Maybe he'll work on that next.
Maybe he will. He probably will. Seems like that kind of guy.
And I think it's also interesting. So Plan D, which is the Medicare prescription drug plan that you buy, either you opt into for Medicare, is also very confusing. The government doesn't directly buy the drugs for you.
Right.
Which, as I was saying before, is kind of doesn't make sense from a cost standpoint, because if you can buy more,
right,
your just buying power is way more effective and you'll be able to drive the cost down for everybody.
Right.
But the way Plan D is set up is that different insurances then vie for the lowest drug price for the consumer. And who knows really how well that's working for us.
Right.
I think the Medicare School, which you can watch on Tuesdays on ROI TV, has a lot of good information about Plan D and the different ways to utilize that system, but and to answer some of those questions there. But I think, man,
I mean, we all know that pharmaceuticals are expensive.
Yeah.
That's tough. On that note, we're going to take a quick commercial break, but we will be right back to talk about the shows airing today on ROI TV. Welcome back, everyone. I just wanted to give you a quick reminder not to miss today's episodes of Your Money, Your Wealth, ETF Stories, and Life's Third Act. You can catch them all on ROI TV. ROI TV. And where can they see them exactly?
On Roku, Amazon Fire TV, Apple TV, or on your phone, whether it's an Android or an Apple.
That's right. Thank you so much for joining us on another episode of Coffee with Kem and Hills. We will see you tomorrow with another big old cup of coffee.